to see a box, and so can you just let me know on Instagram if you able to join me on YouTube? Please type in there, and it would be nice. You are my sunshine. If you're joining in, my only sunshine, you make me happy when skies are gray. You'll never know, dear, how much I love you. Please don't take my sunshine away. The other night, dear, can you get me on YouTube? Please comment, okay? Because I'm going to switch off the Instagram in a little while so that the YouTube people can follow me. And there you warn, dear, how much another. Please don't take my sunshine away. So these lunchtime sessions are basically to have a company with you, to have lunch with you. And you can ask me any question, and I'm going to do some teachings. At the same time, I'm going to bring in guests. And these guests are to talk about skin health. We're going to talk about network marketing, how to make that as a profession. And a lot of people have a lot of misconceptions. And I want to just tell you that this whole concept of SkinMatrix is the way to the future. So we're going to talk about the beauty. We're also going to talk about the beast. And the beast, as far as I'm concerned, is the toxic media that has really ruined so many people that I've seen over the many 35 years now. And I want to just be able to talk to you. So can somebody write to me, send me a note to tell me, Natalie, Jimmy, can you send me a note whether you can get me on YouTube or not? Can you see me on YouTube, girls? You never know, dear, how much I love you. Please don't take my sunshine away. Now, there's a girl called Stella, and Stella said, Doctor, I don't care what you do, but I want you to do one song for me before you start talking. And she said the song is actually Laju Laju. So Cindy, welcome. Cindy is just Cindy says I'm having problem logging into Zoom. No, we're not on Zoom. We are on YouTube. Okay, we are on YouTube because the Zoom channel just doesn't allow me to have your company, and so I prefer to go live on YouTube. So Cindy, if you can hear me, stay on YouTube, because today is just a get together, and then you get a feel of what I'm going to do for the next every Wednesday. So I'm going to sing a song for Stella, and then I'm going to start talking. Okay, Stella wants this song. Laju laju perahu laju, laju lah sampai ke kota Kinabalu, lupa kain dan lupa baju, asal jangan lupa sama saya. Okay, so Cindy and Stella, this one's for you. So Stella, follow me. La yo mama, jangan mama marah beta, dia cium, dia cium beta. Ayo mama, jangan mama marah beta, asal jangan lupa sama saya. Zam has just joined us. Zam, I want you to follow me, okay? Laju laju perahu laju, lajulah sampai ke kota Kinabalu. Come on. Lupa kain dan lupa baju, asal jangan lupa sama saya. Ayo mama, jangan mama marah beta, dia cium, dia cium beta. Come on Zam. Ayo mama, jangan mama marah beta, asal jangan lupa sama saya. Okay. So I hope that has made Stella happy because she insisted that I do that song for her. She's heard me busking at the airport. She's heard me busking in Likas Complex, Likas Complex, no, Likas Bay. And we've been doing this busking for a number of times. But I promised her that in the first episode, it's all being recorded on the live on YouTube. And so this is something that we want to kind of like get together and enjoy ourselves. Now, Mary, come over here. Mary's the only one. Mary, come over here. It's okay, Mary. Quick, you're live. And so Mary cannot leave her station because it's all there. Okay, so we're going to start this SkinMatrix Academy. And we're going to do these sessions live. And I want you to be able to engage with me as a plastic surgeon. I don't know of any other plastic surgeon that is being able to open their hearts out to their people. And I've learned so much, I've heard so much. And I want to be able to encourage all of you that skin health is the priority. If everybody says it's the largest organ in the body, but I can tell you one thing, it's the second largest organ in the body, but it's the most abused. And in my 35 years as a plastic surgeon, I want you to be able to understand that if you don't understand the science behind skin health, then you're actually wasting a lot of your time and money and expenses. And remember one thing, that listen carefully. Cindy, this one's for you. Yes, and stay on with YouTube. When you're 20, you're born beautiful. When you are 30, you make a decision to stay beautiful. When you are 40, you're committed to the decision you made when you were 30. And when you are 50, you invest in the decisions and in the commitment that you have made over the years. And so this is something that is critical because as you continue to develop yourself, thank you, Stacy, you will be able to grow and love the beauty that has been given to you. All right. So this is very important. Now, I'm going to put off the Instagram and I would like you to switch on to YouTube. It's simple. Just get on to Plastic Surgeon Dr. Charles Lee. Cindy is already there. And please press share and subscribe to the channel because we're going to deal with that all the time. And so you can also get me on TikTok, which is mindful_surgeon. And you can also get us on Instagram, Dr. Charles Lee Sabah. So girls, would you come and off the Instagram, and I'm going to continue to stay on YouTube. So if you want to join me and enjoy this first session together, it's not going to be very long. It's just the first launch so that people will know that every Wednesday we'll be having your lunch wherever you are, whether it's laksa, whether it's nasi lemak, whether whatever. Have a time with me. Enjoy my company. And it's good to know that these are the things that we go through in life. But I'm going to talk to you about skin health. I'm not a skin specialist. I'm a plastic surgeon. But because appearance is the most public part of yourself, remember that. 95% of all the selfies you take is about your face. If you go into TikTok, they spend all their time showing other parts of their body except their face, you see. And so everything that's happening today is a toxic media culture, a culture that has actually, I would say, dampened the whole concept of beauty. They say that beauty is in the eyes of the beholder. But I can tell you one thing, if you're not careful, there is a beast behind that. And it's all about camouflaging what beauty is concerned. So I'm going to spend the next, I don't know how many sessions we're going to do. We're going to talk about what's called the SkinMatrix. And I've titled this because this is the key. If you can understand what is the SkinMatrix, you will be able to actually reverse the aging signs. Actually, I'm being telling you that because of scientific proof. And it's not about anti-aging. Aging is a side effect of living. As long as you're living, all of us will continue to age. But we can stall the aging process. We can actually reverse it because of the technology that's available today. And I'm going to show you complications that I've seen, how not to do it. In plastic surgery, much of our practice and training for the first 10 years of our career is how not to do it. You see, so a lot of people are going in for surgery, but it takes years and years to learn how not to do it. And this is why the experience comes in. And if you're not looking for something wrong, then you're not doing it right. So every time we do a consultation, if there's anything that you can learn from this lunchtime together, is how to avoid the problems that we face. And I'll try my best to answer you. But because surgery and the healing of the wounds, and today we know so much about scars and how does a scar heal, you will be careful because I've seen enough. And one of the first signs I want to show you is how to avoid like this, how to avoid, putting things into your face that end up with scars and you're totally mutilated. And all this is because of what is happening outside. And people are able to do so-called aesthetics. When I started plastic surgery way back in 1987, I know some of you may not have been born at that time, but in 1987, when I went to UK, and I was trained in plastic surgery in Cambridge, and then in Edinburgh, and then in Frenchy Hospital. Our training at that time was so strict. You can't just call yourself a plastic surgeon. You have to go through very, very rigorous training. And today, a lot of the people who are doing all this aesthetic work, all they have to do is go for a course, come up with a certificate, and they call themselves aesthetic surgeons or aesthetic clinicians or aestheticians, aesthetic doctors, So there's so much to be able to be cautious. And so I am now here for you as a plastic surgeon, as a board certified plastic surgeon, to really, I may not have all the answers, but definitely I have seen enough to know when not to do it. In fact, yesterday we had a patient that came to see me. Beautiful. She's a model. She's a celebrity. She's a star. She's been in Beverly Hills, and she's seen some of the top plastic surgeons in Beverly Hills. And she came to see me for a problem. And I looked at her, and she was closing 40 years of age. I didn't touch her with any treatment. All I did was to re-educate her thinking, so that she will be able to fall in love with herself again, to fall in love with her skin again, to be able to appreciate the mnemonics of what goes through in the aging process. And this is why plastic surgery is such a real marker today, because everybody is looking for nip and tucks. But I can tell you, if you're not careful, you can end up being sucked into the whole toxic culture today. So I'm going to off now my YouTube channel, my Instagram channel, and I'm going to stay on to YouTube. It's going to be recorded, but this is the first session. So thank you all for joining me on Instagram. Move on to YouTube. And so this is why it's important. So we're going to start with the YouTube, and this is where so these are the sessions that we're going to have every Wednesday, from 1 o'clock to 2 o'clock. And this is the time when we're going to talk to one another. So I've titled these sessions as Lunch at SkinMatrix Academy. And this is where I hope that we can be able to grow. Being the first session, Cindy, thank you so much for joining in. I just want to be able to connect, and I love your company. But we're moving into so many eras over the last 35 years. And the first era, and I want to tell you something. There's a gentleman called Robert Boyle. If you want, you can write it down. Okay, Boyle. I don't know how many of you all did science in college, in school. Remember, we had the Boyle's law and the Boyle's apparatus. I still remember we put it into a test tube, and the whole thing will bubble away. But Robert Boyle was a scientist, and in UK. And nearly 350 years ago, he wrote a 20-point wish list. He was the president of the College of Physicians in London, and he wrote a 20-point wish list, 20 points of what he wished would happen in the field of science and technology. And this is about 350 years ago. And the top 2 points on that wish list was number one, the prolongation of life. That was his mind, his thinking at that time. How to prolong life was a challenge that he put forward to the Science Academy. And the point number 2 was the recovery of youth. You see, so this is something that was on the mind of Robert Boyle. A fantastic, you can Google his name and read the 20-point wish list that he had. And it was the first computed, list, a scientific list of the things that he wished would happen. And today, 350 years later, amazing advances have been achieved in science and technology to prolong life. The period of longevity is being prolonged. You get countries where people are living for 100 years and above. And this is the science behind it. How do you prolong life? And secondly, which is very important for people like us in the plastic surgery field, is how to recover youthfulness. Everybody wants to stay young. You know, there's a song, Forever Young, by Foreigner. And forever young, I want to be forever young. Yes, young at heart, but aging is a side effect of living. And what we want to do during this smart aging talks is to throw away the word anti-aging and embrace the culture of smart aging. How do you spell the word smart? How do you spell the word smart? SMART. Smart. So there is the word ART in the word smart. So there's an art in smart aging. And that's the art that we as plastic surgeons know about, we've been trained for, and that's the art that we tell and culture our patients when they come to see us. So this particular luncheon session that I have with you is how to avoid all the hallmarks of disease and destruction. And there's one word I want to leave with you today as the first launching of the SkinMatrix Academy. Just one word. If you can write it down, it is the key to everything that we do in science and technology and in the management of all the problems that we face in the aging process. And that is the word anti-inflammation. That's the first word in this first episode that I want to leave with you. Anti-inflammation. Because the biggest problem that it's an epidemic, and it's a silent epidemic that it's like a silent killer that is spreading all over the world, and that is inflammation. And how do we counter it? And you will find that because of the advances in technology, the main focus has been anti-inflammation. Now, the word inflammation comes from the root word inflammation, comes from the root word flame, and flame means fire. So actually, from the very moment we are born, at birth, the cells are undergoing what's called inflammation. And that inflammation happens, there are good and bad inflammations, okay? And Cindy, is that Cindy typing out anti-inflammation? Is that right?
Yes.
Excellent, Cindy. Oh, Cindy, listen, you've won yourself a free gift. Come on, girls. Where are the free gifts? Tara, come and tell what's this free gift. I mean, I want to congratulate you. You are the first one that came in and logged in. Come on, show Cindy. Cindy, you won your free gift. And come on, explain to it. I'm going to stop this. Talk to her. Yes.
Cindy, which one do you want?
You don't know what is in, so how can you choose?
Can choose
Yeah.
two.
Explain what is in it.
Yes. Which one? On my left or right?
Oh, okay.
Yeah.
Cindy, choose quick. Yes. I'm talking. You're live on YouTube. I want okay, if you want it all, then you got to take me also. Okay, I come with those packets. But I tell you what,
Let
listen.
Dr. Charles choose.
Okay,
Which one do you
I
want to
think
give?
this is good.
Okay.
This is a lovely hairband which you can use when you go and do your hair or whatever your saloon work. And this is a small little purse. It's a nice purse for you to put your cosmetics and all that when you travel. So this is a travel bag. It's a cosmetic bag and a hairband for you. All right, that's enough. And if you stay on till the end, you'll probably get the other one too also. And well, that's a stress ball and another
Can
hairband,
do.
I think, right? Yeah. Okay. Well do. Great. So Cindy, make sure that you subscribe to the YouTube channel, and at the same time inform your friends to join us on this live YouTube channel, Plastic Surgeon Dr. Charles Lee. So I was talking to you about inflammation. And if you can understand that in fact, 90% of the aesthetic treatments that we do here in the clinic are all anti inflammation because we want to bring down the fire. You see, we want to bring down all the problems because one of the side effects of just living, just the oxidation of the cell, are what are called radicals. Okay, radicals. They are byproducts of what's called an oxidative process. We breathe in oxygen, the cells undergo metabolism, it's an oxidative process, and the side effects, the byproducts of that oxidative process are called radicals. And just as you've heard about radical terrorists and how they get radicalized and they become uncontrollable and all that, there are certain actors in the body called biological terrorists. Write these words down: biological terrorists. And these biological terrorists do nothing but what do terrorists do? They kill and destroy. And in our body, in our system, we have these radicals, and they're called free radicals. Free meaning not that they are bought free or they just come out and they are free to roam. They are free to destroy everything that is building. Their job is to just kill and destroy. All right. So and they roam free. So all the treatment that we do, the thinking processes that we do, is to how to angle and tackle these free radicals so that the amount of toxic processes is less and reduced, and the amount of building, the amount of creating, the amount of stimulation of new skin and new cells and new organisms overpasses that destructive process. Now, I hope that in my next session that I'm going to do what is called, Zoom and live YouTube, and I'll be able to show you. But because of inflammation, that's the reason why you will see faces like this. Okay, let me see if I can get closer. You understand? And you will see this kind of things that happen on account of what are so-called fillers. And so I'm totally the last person to do fillers. And so I'm going to talk to you over the next few sessions on number one, what is the whole concept of skin matrix. We call it matrixing here. And my concept of why I call it skin matrix, because all the technology that we have today is all about the matrix, you see. So the skin has got two layers. It's got the epidermis and the dermis. And it is this dermal matrix that continues to revolutionize the whole concept of beauty. Today, all the mechanisms of technology, the advances of technology, everything that is happening is focused on the matrix. And if you can learn about the matrix with me, you'll be able to choose and tailor make your skincare regime, which is very important. How to choose a sunscreen, what does it have? And on this particular channel, lunchtime, I will be inviting dermatologists, top dermatologists here in Sabah, to talk about different aspects of the skin. For example, sunscreen would be the first one that I would talk about, because sunscreen is the most important skincare on your shelf. If you do not have a sunscreen or a sunblock on your shelf, then you are not going to be able to have nice, healthy skin. So on this particular live channel, look out, search out, stay out, white out for all these programs that are coming in. Who are the speakers, guests, invitees from me? are my guest list, and so we will include dermatologists. We will also include those some celebrities who have actually been able to keep their skin looking beautiful, as far as I'm concerned. So I choose very carefully because there are so many beauty pageants today that beauty has been totally monopolized and actually been abused, as far as I'm concerned. And these beautiful women or ladies have become targets for all sorts of media promotions and all that, and they forget that it's not a commodity, it's a blessing to be beautiful. And like I said, you're born beautiful. All of us are born beautiful, but that beauty at the age of 20, that's when the aging process begins. Aging process begins at the age of 20. And I'll be talking to you about a process called anti-glycation and how these glycation side effects, the so-called AGEs, anti-glycation end products, they advanced glycation end products, they end up in destroying the texture of the skin. So we'll be talking about that as we move along. And then I will be taking you to the different eras over the past 35 years in my practice. What the first era was, the era of stimulation, where we started to learn all these chemicals that we can put into the face. Remember that anything that is injected is chemical based. Okay, and that's why I'm a big believer in some of the botanical plant extracts that are being used for skin rejuvenation. But even then, they are still processed in some form of a way, and which is not natural. So these are things that we can talk about, and at the same time, we've got people who have actually done some fantastic work in losing weight. So how important it is for that. And I think another very important point is on network marketing. I've been doing network marketing for the last, exposed to it for the last 25 years, I think. And I believe that it is such a powerful profession. Okay, so you can throw away the word MLM, but network marketing is a profession. And to me, when there's something good, the best way to get it out into the marketplace is through network marketing. All right. I see the number of people whom we have treated here. They come with their bags and they've got about 7, 8 skincare in it. And we don't know what on earth, they don't know what is inside that skincare. And either it's an essence 1, essence 2. And then I'll say, what's this? Oh, this one is super essence. And what's this? Oh, this is night cream. And what's this? This is day cream. And what's this? This is neck cream. And what's this? They got the whole world in their bag. And uh, and when I ask them what's in it, they don't know, you see. And this is where the toxic media culture comes in. So you need to be able to enjoy these lunchtime sessions with me, so that we'll be able to grow in grace. We'll be able to understand when you're looking for a sunscreen, what to look for. And so these invited guests that I bring on board will be a big blessing to all of us. And we may enjoy life, enjoy beauty, enjoy, like I said, I was playing this music, right? And what did I say, Mary? That life is like a disco, right? As long as the music is playing, dance. The music will change. You go to any disco, the music changes. So even if the music changes, you keep your job and my job is just keep on dancing, and you will find that that's what's been happening over the years. But why did I start these lunchtime talks? Is because the amount of problems I'm seeing in my practice. I'm seeing threads come out through the nose. I'm seeing pus from infection from thread lifts. I'm seeing uneven. People have been doing liposuctions to the chin area, and all these. And remember, liposuction, the fat suction is permanent. So whenever there is any damage, it is permanent. And so I've seen it over the years. And when you put in threads, and it gets infected, you've destroyed your face. I see something that is so common today. Is a lady who came to see me. Her breasts were up to her neck. Okay, and she had gone to a hotel somewhere, and someone came and pumped in some liquid into the breast. I don't know what. I think it was soybean or something. I can't remember what was it, but the whole thing got infected, and she came like a floating balloon, and totally destroyed her breasts. I've seen people who have come in here with their buttocks and oil dripping from their buttocks because they've had siliconomas injected into their buttocks. I've seen people who come in with chins, they look like Wizards of Oz, and that's because the fillers that they use are not medically graded, and so they've ended up with this granulomas. We call them granulomas. We've seen all sorts of problems, and I want to talk to you about the media and how toxic it can be, and I've been through it. So I just want to share this moment as the first lunchtime session with you, that there's so much to chit chat about, and I wish that you'll be able to talk to me, write to me, and be able to grow through it. So the first thing that I'm leaving with you today is the word inflammation and the word anti-inflammation. That's key. Be it health and be it anything else. Okay, the inflammatory process is the silent epidemic that is killing all of us across the world, and I know it. And I want to share with you some of my personal journey of health. Nearly 10 years ago, I had open heart bypass surgery, and what that meant to me. So I'll have one session on that, where how it affected my life. Have I learned from it? No. Have I changed my dietary schedule? No. Have I been doing anything about it? Yes and no. So these are problems that we will face in life as we go through. And I'd love to, if any of you are out there and you want to come at all, and join in fact, and have a chat with me here live, why not? It's a free platform that we can enjoy each other. And I really I want to make this a point to you. So right now, in the plastic surgery field, in the field of beauty, in the field of aesthetics, is the era of biovitalization, bio revitalization. And I put the word re separately because everybody wants to talk about vitalizing and vitalizing this and all that, but actually it's a whole process of revitalization. And because of technology, we are able to leverage on the technology that we have today, to be able to do that. In fact, as I was coming in this morning to work, there's an article out by the FDA, which is the Federal Development Authority in America, and the Food and Drug Administration, which is the FDA. They kind of like certify all the products that we use. They are from America. Every device that is here, for example, most of the equipment that I have is from America. The Thermage is from America. Hydrofacial is from America. And one of these sessions, I'll just take you around with the girls and show you what we have. But they've just come up and launched what is called dermal resurfacing. See, the whole concept today is the dermis, the dermal matrix. That's the key. Over the last 35 years, they're finally, at one time, when we talked about biostimulation and we talked about lasers and all that in the beginning, 35 years ago, it was all about skin resurfacing. It was about resurfacing the epidermis. They thought that that would be the key, that if you just go in and do some laser treatment or resurfacing, you'll get new skin. But they forget that there's a source to that new skin. And today, after the era of biostimulation, became the area of rejuvenation. So they started, they've learned the science about the epidermis and the cells and the lifespan of the keratinocytes, which are the superficial cells. Can I have that laminated copy, please? And those are superficial cells, where it's called the skin cells, which are called the keratinocytes. So I want you to write that down, keratinocytes. Mary, write it down, type it down, keratinocytes. And so if I were to show you some of these models that we have, when you come and see me in the clinic, you will be able to see this. And so if you're out there, let me just share it with you. So this is the skin layer, and the skin layer, the epidermis has got about 5 layers, and which is right up there. The one that is right on the top is called the stratum corneum, which is a very conified layer. And as you go deeper and deeper and deeper, you come to what is called the germ layer, okay, the basal cell layer. And this layer called the basal cell layer is the one that generates all the new cells, the new skin cells. You understand? So this basal cell layer. So if you don't have the science of exfoliation, if you don't know what exfoliation is all about, you're going to have problems deep within. They're going to be piling up with dead cells. And that's the reason why we get skin cancer. And the skin cancer is called basal cell carcinoma. All right. And it arises from this basal cell. So that's why when we talk about hydrofacial, the machine that I have here, it's about 84,000 just to do a facial. Because it's top class, and we're going to have a session on that, all right, called the hydrofacial. In fact, next week, what we're going to do is we're going to put out all our aesthetic machines here, and we're just going to have a talk about what we have. So you know where to go, you know what to learn, you know what to ask, you know what the direction of your skin, journey would be there. Okay, so that we're going to do. So all these green cells that you see are new skin cells, and how do you stimulate them? Let's say this is a person who is 39 years old. These keratinocytes that are there are also 39 years old and or older. So remember, there's a biological age to your skin and there's a chronic age to your skin. So if you're 39 years old, then that's your chronological age. But the biological age of the skin is much older. All right. And our concept here in smart aging is to make your skin younger. All right. So how do we do that? So we'll talk about that as we go along. And so that's the SkinMatrix. That is why we formed this academy. The word academy is as if you're going to school. No, the word academy is more of a teaching environment, a company that we come together to learn. It's more of an educational concept. And so this was just released. FDA talks about a plasma device system that will be able to resurface the dermis. Can you imagine? They're going deeper and deeper. And that's because of technology. So when I hear people who are going for things, they're calling the clinic and they're asking my girls, does Dr. Charles Lee have got pico laser? So they always reply and say he'll come and he'll pick your brain more than he will pico laser your skin. Pick your brain meaning he will ask you questions of why are you looking for the pico laser. Okay, so remember that a lot of beauty that comes from within has to show out from the outside. It starts from the inside. And I believe that the biggest move in skin health or in the beauty industry as a whole is to think of the skin as a system. Write it down. Skin as a system. Okay. So when you, for example, if you talk about your stomach and you talk about the intestine, that's called the digestive system. If you talk about your brain and you talk about the nerves and you talk about the spinal cord, that's called the central nervous system. If you're talking about the heart and the blood vessels and all, that's called the cardiovascular system. But very often we talk about skin as an organ. No, it's a system. Because if you look into the structure of the skin, it is amazing. The number of organelles that are in the skin, amazing. And this structure protects your inside environment. So if you're a master of this and you know how to handle this, you'll be able to stay young, and you'll be able to enjoy what Robert Boyle talked about was the recovery of youth. How do you recover youthfulness? So today it's all about youthfulness and how to stay young and healthy. And so this is what I wanted to share with you today as the first episode of what we plan to do during these lunchtime talks. Is number one is to enjoy each other's company so that you'll know more of me. And I will be able to talk to you as I now see Cindy responding so well, and she's earned herself some nice free gifts. And Cindy, if you come and see us and you want to do a hydrofacial, we'll give you an extra special discount. Okay, so that's special. So all those who come in and join us during our training or during our sessions will get something that they can go back with. All right. So today I've learned a word called anti-inflammation, which is very, very key to all the processes of treatment that we do. I'm going to talk to you also about, as I said, invite specialists to come and join us. There's a young man who came to see me. He must be about 29 years old. I hope to get him to come and join us. And he was 198 pounds. And when he came to see me, he had come right down to somewhere around uh, 90, 90 odd pounds, something like that. I can't remember, 90 kgs, I think. Oh, yeah. But anyway, he lost 50 pounds. He walked in and he was looking, young man, looked so good. And but he had some problems with his legs and the veins were not working well. We call them varicose veins. So in Malaysia, I'm the only plastic surgeon that uses endovenous laser to treat varicose veins. Okay, usually it's done by the vascular surgeons, but I was trained to do that, and I think this is very important that we do not forget the veins in our legs, because they are the second muscle pump. They are the second pump of the bicycle, the second wheel that brings the skin back. So remember, when we talk about skin health, we talk about, first of all, cell metabolism. So that's something that we will talk about. And then we talk about lymphatic metabolism, the piping system that takes away all the muck that's inside the whole skin complex. And then we talk about the vascular system, very important. For example, those who are suffering from or having problems or melasma, for example. Melasma is a very, very difficult skin pigmentation problem. It's all in patches and upper lip and over the nose, and you get this butterfly appearance it's called melasma. And now we know that there is a vascular component to it, and how yellow light has now given some beautiful, nice results to calm down the vascular effect of it, component of melasma. And so this is incredibly advancing the really negative treatments when it comes to problems like this. Um, and then we talk about acne scarring, we talk about stem cells, how we have improved in stem cell structures today, some of the top stem cells that we are using here in our practice. So I think this is very important. Cindy says, Cindy, if you're in KL, yeah, Cindy, I was just in KL last week or 2 weeks ago, and so make a trip here. Yeah, come and enjoy your time with us. So there you go. I think it's about time now to wrap this up. I just wanted to give you a flavor of what these lunchtime sessions will be. And we hope to go through the mechanics. And don't forget network marketing. I'm a big believer. 25 years ago, 30 years ago, 1991. I remember I love talking, and I love meeting people, and I love sharing good news. And the best news is when you've got something that helps with your skin health or something that helps with your body health. And and so my first exposure to network marketing was with Shackley. I don't know how many of you all know about Shackley. And so I used to have people come up, to the clinic, and some were patients, some were outsiders who come in, and we will talk about network marketing because it's a fantastic profession, where you have something that's really good, but it can go out to a number of people than just one-to-one over the counter. And a lot of stuff that's over the counter is really a low level type of stuff. Whereas most of the marketing products that at least we use here, I know, have been well researched and well tested, and are good products. Okay, so I'm going to talk to you about network marketing and what we use in our practice, so that you can build an income for yourself. Never look down on it because it's a profession. And in that network marketing, how to close up your sales, and how to really take it in as a profession. And that was my first exposure, Shackley. And then after that, I was exposed to something called Noni Juice. I don't know how many of you all have heard of Noni Juice. Great stuff. It comes in a bottle, expensive. And I loved it because it comes from the morinda tree, and from Polynesia. So it was Noni Juice, and then after Noni Juice came don't know what, something else, and then we were doing Mac Ocean and Ashtar and all sorts of platforms that we can make a second living and a second income. So yeah, network marketing is definitely something that we will talk about. Hopefully next week, to introduce network marketing, I might invite. I will have a lady who is a powerful marketing expert, a young girl, young lady, and she earns about 60 to 80,000 a month. So listen, don't think that there is nothing out there that you can't earn a living. The best investment in real estate. In fact, yesterday I was telling about the model who came to see me, a beautiful woman, and we sat on talking, and I was asking her, what's the best real estate that you would put your money in and you will invest in? And she mentioned stocks, and she mentioned, what else did she mention? She mentioned bonds, and she mentioned property, and then what else? And she mentioned everything under the sun,
Gold.
gold. She mentioned gold. And then I took the paper and I drew a big square and I put you. The best real estate investment is yourself, because nobody can touch you except yourself. Nobody can look down on you except someone else. So you are more than enough. You have enough in you to make yourself successful. And so I just want to tell you this, that as we close this first session, that the best real estate is yourself. So when you educate yourself when it comes to skin health, I'm not a skin specialist, but when you start to love this conversation that we will have together during lunchtime, I'm going to invite this young lady to for probably next week, so that I can just bring in some of the points that we want to talk about over the next few months. And we'll talk about network marketing and how she started and how is she earning 60,000 to 80,000 a month. Wouldn't you want to? I want to, where I can tone down all this. My girls can, all of us, enjoy and sing and dance, but excellent product, well researched, tested, and that's the key in plastic surgery. Look for what is wrong so that you'll make it right. And when something has got all the right ticks to it, it cannot be anything better than what you have. So these are the plans that we have, and I want to just thank you once again for joining us. Yeah, Noni Juice. Sahira says, yeah, it was great fun, and I got a shock, that the other day during that time, this is like 20 over years ago, and I was driving somewhere in KK, and then I saw a noni plant with a noni fruit hanging there. I didn't know that they have noni fruits here, but please stay in touch. Okay, we'll see you next week. We will have Q&A, and next week's Q&A would be on a topic called exfoliation, because previously last week we were talking about acne-prone skin. And if you understand what is acne prone skin, we talked about all the different grades to it, stages to it. And so next week we're going to do exfoliation. Now we've got some questions here. Yeah, so now the last 5 minutes I'm going to be for questions. Doctor, for your next session, please talk about vitamin A drip and how it helps to tackle acne skin. Sure. So when we talk about exfoliation, we talk about the keratinocytes, which is very important, and that's a skin cell. And as I said last week, when we talked about acne, we said that the acne is because it's due to this pilosebaceous unit, there is the hair. And can you see these glands here? They look like mammary glands. They look like, is it on? Oh, okay, let me show. Yeah, this is clear here on this side. So you got these see, they are called sebaceous glands, and they secrete sebum. All right, so this is called the pilo, which is the hair sebaceous unit. And so when you got a lot of keratinization going on, or hyperkeratinization, these cells form what's called a soft plug and blocks it up, and then you get this whole inflammation process. So when you talk about anti or acne prone skin and how do you tame it down, the concept is when you use things which are anti-seboric, means they tone down the sebum secretion, anti-inflammatory because it's all very angry, it's in flames, it's in fire. And so whatever products that you do, whatever cleansing that you do, is to tone it down, calm the skin down. You can't control some of the factors, for example, stress and periods and all that kind of stuff. But definitely, Sahira. So Sahira has actually won herself another free gift, huh? Mary, let's see. Tiara is today very happy. She's waiting to come and show you a free gift. Okay, so what's in this free gift? Sahira, you spotted right on, my favorite vitamin. And you want a free gift just like Cindy did. So whatever names I see will win. Okay, what's in this?
This is a hairband.
Hairband.
Yeah.
I can do something for my hair. Okay, so okay, it's actually a thermage band because we've got thermage, and so Sahira, this hairband will help you when you're going for your facial. A lovely material actually,
And
and
this is a stress ball.
you can't hear. Can hear? All right, this is a stress ball. So you have a choice whether you want one or two balls. And I love these stress balls, because when the girls make me upset, I just keep pressing these balls. So yeah. So anyway, Sahira, wonderful. I'm so glad that you know about vitamin A. It's key. Remember that. Okay, this is the last point because Sahira brought it up, and that is every cell. You've heard of vitamin C. You've heard of glutathione. You've heard of CoQ10. You've heard of all the other carotenoids that are actually forming what's called an antioxidant brigade. What's a brigade, right? So this is like a platoon, and this platoon protects the garrison. You know what I'm trying to say? So these antioxidants, which is vitamin C, vitamin E, glutathione, CoQ10, all these are called antioxidants. They protect what's in the center, which is vitamin A. So vitamin A is a very powerful vitamin. It regulates the DNA of the cell. It's important for cell immunity. It's important for cell health. And so every time we do any treatment here, we always run in and do a vitamin A